You wake up at 3 in the morning, your wife's sleeping beside you, and you realize morning erections have disappeared completely. You cannot remember when it started, a month ago or 6 months. The timeline has blurred. 70% of men over 50 experience this. 7 out of 10. Most assume age caught up with them. Nothing can reverse it. Time to accept reality. That conclusion is wrong. This is not age. Your body is dealing with blood stagnation in your perineum, weakened nerve pathways to your pelvis, and atrophied pelvic floor muscles from sitting too much. All three conditions are completely reversible. One specific point changes everything. 1 minute of pressure applied correctly to this point daily restores blood flow, strengthens nerve signals, and rebuilds muscle tone. 14 days of consistent work, and morning erections come back. I have seen this hundreds of times over 15 years in urology practice. But there is a critical factor. Apply pressure incorrectly and you can cause serious tissue damage, making your condition worse instead of better. Right now, I will explain what exactly happens in your body and why this technique works when everything else fails. Most doctors will not take the time to walk you through the actual physiology, which is why men keep buying supplements that never address the real problem. Over 15 years treating hundreds of patients with this exact issue, I learned something critical. Your body is not broken, it's simply lost efficient communication between key systems. Proper erectile function requires 3 systems working together simultaneously. Your brain sends arousal signals through nerve pathways to your pelvis. Your blood vessels expand and allow powerful blood flow into erectile tissue. Your pelvic floor muscles respond quickly and maintain firmness throughout. I want to give you something that can make a real difference starting today. I have created a complete guide for you, 5 simple steps to boost your sexual health. This is not theory. These are practical, science-backed actions you can implement immediately. Inside this guide, you will discover the exact protocols I use with my patients, how to optimize your testosterone naturally, what actually reduces stress and restores function, the specific foods and exercises that support hormonal balance and blood flow. Everything is clear, specific, and proven. Go to the link in the description right now and get your free checklist. Take action today. Your confidence and health are worth it. When all 3 systems coordinate properly, everything works automatically. After 40, these systems begin degrading in predictable ways. Nerve pathways slow down like electrical wiring that developed weak connections over time. Blood vessels lose elasticity and restrict flow like rubber hoses that became stiff from years of use. Pelvic floor muscles weaken because most men never knew these muscles required maintenance. This degradation explains why morning erections fade gradually, not because of age itself, but because these 3 systems stopped coordinating efficiently. One specific zone in your perineum acts as a convergence point where all 3 systems meet. Major nerve pathways pass through this zone on their way to erectile tissue. Primary blood vessels that supply the penis run directly beneath this area. Pelvic floor muscle groups anchor to this exact location. When you apply targeted pressure to this zone correctly, you stimulate all 3 systems simultaneously, reactivating dormant pathways, forcing restricted vessels to expand, and engaging muscles that have been idle. However, incorrect pressure or excessive force causes inflammation, further restricts blood flow, and creates new problems where none existed before. Before I show you the exact technique, you need to understand why this approach works when medications and supplements consistently fail. Medications work systemically by flooding your entire bloodstream, hoping some benefit reaches the target area while most gets filtered through your liver. Supplements follow the same inefficient path, distributing compounds throughout your body instead of concentrating them where you need them. This technique bypasses that entire system by targeting the problem zone directly through external physical stimulation. The area between your scrotum and anus is your perineum, a section of skin that most men never consciously touch throughout their entire lives. Just beneath this external surface, approximately 2 to 3 centimeters deep, sits your prostate gland surrounded by dense networks of nerves and blood vessels that control erectile function. When you apply pressure to this external spot, you essentially perform an external prostate massage, forcing fresh oxygenated blood into tissue that has been stagnant, waking dormant nerve pathways, and activating pelvic floor muscles that forgot their function. Finding this spot requires simple positioning and basic awareness of your own anatomy. Sit comfortably or lie on your back with knees bent, whichever position feels more natural. Place your index and middle fingers together on the soft tissue between your scrotum and back passage, then press gently inward until you feel slight firmness beneath the surface, almost like a cushioned nodule of tissue. That firmness indicates your prostate location. The spot may feel tender or sensitive, especially during first contact, which actually signals congestion and restricted circulation that needs clearing. This tenderness confirms you found the correct location. The next critical element determines whether you get results or risk causing harm, which is the exact pressure application and movement pattern during massage. Position yourself comfortably, either sitting or lying down with knees bent, ensuring complete privacy since muscle tension will undermine effectiveness. You can apply coconut oil to reduce friction, though this remains optional based on personal preference. Place your index and middle fingers together on the perineum spot you just located. Pressure application determines success or failure. You need firm, steady pressure without causing pain, similar to pressing a doorbell that requires slightly more force than usual. Start with lighter pressure and gradually increase as the tissue warms and softens beneath your fingers. The massage pattern follows a specific directional sequence that matters significantly for results. Begin with small, slow circular movements clockwise for 30 seconds, which forces fresh blood into your pelvic region and directly into prostate tissue. You should feel warmth building and possibly slight tingling, both normal responses indicating increased circulation. Then switch to counterclockwise circles for 30 seconds, which releases tension locked in pelvic floor muscles and clears stagnant congestion. Maintain consistent firm pressure throughout the entire 60 seconds while breathing slowly and deeply. The breathing pattern enhances results substantially. Inhale through your nose for 4 counts, hold for 2 counts, exhale through your mouth for 6 counts. This rhythm relaxes your entire pelvic region and pumps oxygen-rich blood into the treatment area. Perform this protocol twice daily without exception. Morning sessions work best immediately upon waking while your body remains relaxed in bed. Evening sessions before sleep flush out congestion that accumulated during the day. You can also massage 15 minutes before sexual activity for immediate firmness enhancement. Consistency determines everything here because missing sessions resets your progress completely. When performed correctly, this protocol produces predictable week-by-week improvements that I have tracked across hundreds of patients. Understanding realistic expectations prevents abandoning the protocol prematurely. Days 1 through 3 bring warmth and possible tingling as blood flow increases in stagnant areas, with mild soreness indicating effective congestion breakdown. Days 4 through 7 produce first observable changes as morning erections begin returning, though initial firmness may be partial and brief while your body relearns automatic responses. Most men quit during this phase assuming failure, yet their bodies are progressing exactly as expected. Weeks 2 and 3 bring substantial improvements with firmer erections lasting longer, faster arousal without mental effort, and naturally restoring automatic function. By week 4, most men achieve full restoration with consistent morning responses, improved sensitivity, and recovered confidence. Individual timelines vary based on underlying cardiovascular health and symptom duration. Severe circulation damage or advanced diabetes extends recovery time, while recent onset responds faster than chronic dysfunction. One 54-year-old patient with 2 years of complete dysfunction felt only warmth during week 1, achieved consistent morning erections by week 3, and maintains results 6 months later through occasional sessions. Consistency determines outcomes more than any other factor, as missing sessions resets progress and forces rebuilding from the beginning. Now you need critical safety protocols that prevent injury during this process. Never exceed 60 seconds total massage time per session, as excessive stimulation causes inflammation rather than healing. Stop immediately if you experience sharp pain, which indicates too much pressure or incorrect positioning. Avoid this technique entirely if you have active prostate infection, recent prostate surgery, or severe hemorrhoids, as massage will worsen these conditions. Start implementing this protocol tonight. Locate your perineum between your scrotum and anus. Press gently to feel the firmness, indicating your prostate. Before bed tonight, perform your first 60-second massage with 30 seconds clockwise followed by 30 seconds counterclockwise using firm, steady pressure while breathing deeply. Tomorrow morning, repeat this exact protocol while still in bed. Perform this twice daily for 14 days minimum without missing sessions. Week 2 brings noticeable changes. Week 4 typically restores morning erections for most men. This works consistently, but only when performed daily without exception. Subscribe for more evidence-based protocols addressing men's urological health. Comment below whether you are starting tonight, then return in 2 weeks to update your results. Your progress might motivate others to take action.